Dear all, thank you so much for taking time for my new webinar. And today we announce our new upgraded formulation of our iconic solution, Myo-Fix. I'm sure that everyone who is working with Meder loves Myo-Fix because it's one of our most best-selling solutions professionally and in the home care. So today I will speak about new Myo-Fix and why it is so important in 2024. Our slogan is live fully, express freely, and age beautifully. So just for all of you who doesn't remember everything about our brand, the brand name, it's my family name because I am a medical doctor, dermatologist, specialist in the cosmetic safety. And I developed the brand in 2009. So Meder Skincare is already 15 years of the market. And we have, such a long story behind us. For now, we have 34 of home care products and 6 of professional treatments. And we're still manufacturing everything in Switzerland. We are present to you medical grade skincare. And all of our professional and home care products are microbiome friendly. We are using exclusively innovative ingredients, which are scientifically proven to be efficient. And all of our products are pregnancy safe, inclusive, can be used during the summertime because they're never photosensitizing the skin. Longer you use Meder skincare, better your skin will resist to the ultraviolet. And also they are cruelty-free. We never used any animal testing. They are hypoallergenic and suitable for all skin types, including highly sensitive skin and damaged skin. And we are trying to make them as environmentally conscious as we can. Myo-Fix was our very first Meder skincare solution, which I developed because I was so passionate about peptides and probiotics in the skincare that I tried to introduce it to big brands I worked at this time, such as Talgo Laboratory in France and Cell Cosmet, Cellman in Switzerland. Still love them, but they didn't accept my idea to incorporate peptides and probiotics in the skincare. I can quote them. They told them that will never be the mainstream. No one can put bacteria in the skincare, but look at us now. I was sure that peptides and probiotics, they are the future of the skincare. And finally, 15 years later, everyone is speaking about it. So Myo-Fix represents the first new category and new generation of peptide correction of mimic wrinkles. It is a toxin-free correction. We never used any kind of toxic substances. And we use it to prevent expression wrinkles, to eliminate or correct existing expression wrinkles. It can be used to prolong Botox injectable results. When I say Botox, I mean Botox, Dysport, Xeomin, all kind of injectable treatments based on the botulinum toxin. It can be used as an alternative to Botox injections, especially for this category of people who has a contraindication, such pregnant women, breastfeeding women, people suffering from asthma or from some kind of neurological or immune disease. And Myo-Fix is absolutely safe to use during pregnancy because peptides are safe. And it doesn't increase the sensitivity to the ultraviolet as an opposite to retinol-based anti-wrinkle solution. Myo-Fix can be safely used during the summertime and sunny period of the year. And obviously, good for all types of skin, all genders, all ages. How it works? It works via nervous system structures. It doesn't work via, it's travels via the skin, but it travels via the skin to interact with the nervous system structures in the skin and with mimic muscles entwined into the skin. And just to remind you that we have a lot of skin nervous elements in our skin, like Professor Laurent Misery once said, and I still quoting them for all these years, then skin and nervous system, they are siblings missing each other since the moment of birth and messaging each other daily. Because, as you remember, skin and the nervous system, they are literally the same organ. They represent the same organ embryologically because it was separated only at the moment of embryological development in 5-6 weeks of embryo's life. Before this time, it was still the one organ, ectoderm. And during the embryological development, it's just split to the two different organs. One of them, it is the nervous system, which grows like a tree in our body, connecting each cell of our body to our nervous system. And another part of this ectoderm, it is a skin covering the body, but they're still very much related. So we have skin cells, which plays for two themes, like keratinocytes. Yes, they're skin cells, they're epidermis cells, but they're nervous system cells in the same time. Melanocytes, pigment cells, we call them sometimes skin neurons because they're so similar to neurons. They have dendrites, they're big, they can move, and they share exactly the same biochemical language. Langerhans cells, they are cells of immune system, and in the same time, they are cells of nervous system in the same time. Merkel cells or tactile discs or receptors, once again, nervous system and skin, tactile disc, and finally, sensory and motor neurons. And when we speak about motor neurons, we speak about the structure which communicates directly to our muscles. We have motor neurons in all of our muscles in our body. And obviously, we have motor neurons connected to each of our facial muscles, expression muscles. What is the difference between body muscles and facial expression muscles? Body muscles, they are attached to bones. So when our body muscles contract, our bones moves. That's how we move in this world. But facial muscles or expression muscles, they are entwined to our skull by one side, but other side is entwined directly into the skin. And when they're entwining into the skin, they do it very near to the skin surface because the entwinement of expression muscles is based next to basal membranes, next to melanocytes. So when your facial muscles contract, so you express some emotions, for example, you're worried, you're frowning, and your muscles contracting between the skin and the skull, forming lines, folds, and wrinkles. If you experience the same emotions during the day many times, it can provoke the wrinkles formation even at the early age. And that's how we eliminate wrinkles and we prevent wrinkles. We interact with the sensory and motor neurons, and we interact with facial muscles using our peptides. Peptides, they are signaling molecules. They are small molecules which can transmit the message. So let's see how wrinkles are formed. When people are speaking about mimic wrinkles, especially in the context and in the frame of the botulinum toxin injection treatment, I feel like they're speaking only about one factor of mimic wrinkles formation. And it is a very important inner factor, active mimic, because we express our emotions, our face takes about 80% of message. And all of you who are speaking more than one language probably remember how difficult it is to speak by phone when you're starting speaking the new language, because you feel like you understand and you can speak already, but speaking by phone, suddenly it becomes so much more difficult. Why? You don't see the face. And we need to see the face, we need to see facial expression to understand even the language better, to understand the verbal messages, because all our communication, it is a combination of verbal, when we say words, and non-verbal, when our face change expression, when we do some gestures. So active mimic, it is an absolutely essential part of our communication, but active mimic, when you have some persistent of specific emotions or stress-related changes and or you're experiencing the stress all the time, it can create lines and wrinkles in the area of active mimic. But it is not only about the active mimic, because children are very active in their face expression, right? They are doing different faces all the day long. But after they sleep and they look like little angels, they don't have any wrinkles. Why? Because they don't have other factors affecting their skin. And we adult people with an age, we have more and more of them. So older we are, higher is the risk of wrinkles development, and higher is the chance that you have wrinkles already. So what are other inner factors? It is, first of all, genetic. Some of us are more lucky than others, and genes involved in the skin strength, in the skin elasticity, they are more active. So these people who are genetically predisposed to the prolonged skin use, they develop wrinkles later. And opposite, some people, they are genetically predisposed to the earlier skin aging, so they can develop wrinkles earlier. Also, there are absolutely physiological, healthy, age-related skin changes. Our body changes with age. It starts in the very first day of our life. Technically, we are aging from the first minute of our life, just until some point we love it, and we call it growing. And after some point, we look at the mirror and we're like, no, now I am aging and I don't like it. So age-related skin changes, at some point, they became destructive. They lead to the degradation of collagen fibers, degradation of elastin fibers, decreasing synthesis of these essential proteins in our skin, and decreased synthesis of hyaluronic acid. So our skin became less elastic, less strength, and it became much easier to develop wrinkles in the skin, because it just it regenerates and restores much more slower. But also there are external factors affecting our skin. It can be hormonal balance, and the best example probably it is menopause, when the level of estrogen starting to be lower, and this estrogen support to our female skin is very important. So suddenly we have less of collagen in our skin. So once again, develop wrinkles. Stress hormones and stress levels. Higher the level of stress hormone cortisol, higher is the risk of wrinkle development, because cortisol is pro-inflammatory. It triggers inflammation in the skin, and it provokes the loss of skin elasticity. Different lifestyle factors, sleep health, sleep hygiene, your physical activity, and so on. Skincare, obviously, which can be very helpful, which can help prolong your skin longevity, but it can be damaging if it is used uncontrollably, and it can damage the skin, and it can accelerate the skin aging. Unfortunately, we see it a lot amongst our clients, right? Especially amongst these clients who never been consulted properly about their skincare. Diet, which can be a healthy factor and unhealthy damaging factor, and such of external factor like an ultraviolet damage, one of the crucial factor for the skin health and for the skin elasticity. And obviously, more your skin is exposed to the active ultraviolet, higher is the risk that you develop wrinkles, and higher is the risk of different kind of skin health issues. Smoking, same as an ultraviolet damage. Air pollution, those of us who are living in the big cities are exposed to the air pollution, and it is the factor acting on our skin as smoking itself. And also, unfortunately, it accumulates with ultraviolet damage. So if you are living in the sunny, big megapolis, probably your risk of wrinkle development is much higher. But if you are a skin practitioner, dermatologist, aesthetic doctor, beautician, practicing in the air-polluted, sunny megapolis, that's no best place for you, because there's so many people who are experiencing wrinkles, skin damage, pigmentation, and another problems, and they will find you one day. And skin dehydration, damage of the skin barrier function by all these factors. If the skin is dehydrated, it develops wrinkles. It's no if, it's mostly about where, and it will be early. Also, the new research about face expression affecting our emotional life. Why I'm speaking about it? Because until this moment, the most popular treatment of expression wrinkles, it is still botulinum toxin injectables. Since the moment it appeared on the market in the beginning of 2000s, it became absolutely popular, and its popularity increasing every year until the recent year. But new research shows that Botox and all Botox-like injections treatment based on the botulinum toxin brings some hidden danger, which we didn't discuss previously. We discussed a lot about secondary non-responsiveness to the botulinum toxin, some kind of side effects and so on. But also, it was found that regular use of botulinum toxin-based injections reduces your empathy. So you feel less empathy toward other people if your face expression is constantly paralyzed. It's reducing the ability to recognize emotional context. And there are a lot of new research showing that Botox users can recognize strong emotions, but they're absolutely lost in recognition of mild emotions. So if it is someone who is a little bit happy or experiences a low level of anger, you will not see it. So it really, really damages the social communication. And also, unfortunately, it's reducing the ability to learn if the subject is emotional, and emotional subjects, for example, literature or history or even geography can be emotional. And surprisingly, it's reducing the sexual satisfaction, especially amongst women, because it was found that face expression and facial muscle activity is closely related to the sexual pleasure in the women's life. So it's reducing the emotional spectrum in total. And it's really, worrying finding. And now scientists, they're speaking about the importance of facial muscles feedback to our emotional intelligence, to our emotional brain, because it was found that we have this facial feedback loop. When you experience some emotion, you express this emotion, probably verbally, and most importantly, non-verbally. And when your muscles are contracting, it sends feedback to your brain that you really experience this emotion. And it is very important in the social communication and in your own emotional life. Actually, it was found some positive feedback about it because you probably know that botulinum toxin injectables are used for more than 10 years for patients suffering from depression, and it helps them to reduce the depressive component in their life and to experience less of negative emotions. But in the same time, it was found when injections have been performed in the area linked to the positive emotions, for example, crow's feet, they are linked to smile. When you block the lateral part of eyes, orbicularis oculi muscles, it will reduce your experience of positive emotion as well. So when your crow's feet are eliminated by botulinum toxin, you feel less happy. And I think we should really discuss it and we should think about it. What is amazing about peptide-based treatment? It is toxin-free relaxation of mimic muscles activity, and it is partial, superficial relaxations, which keeps you still emotional because your emotional feedback is unaffected. Your facial muscles are still active. Only superficial part of it, about 15 or 20% at max of muscle length, will be relaxed. And it is not a toxic paralysis. It's peptide-based relaxation. So it does not affect your empathy. It does not affect your emotional intelligence. It preserves your natural facial expression. Only things will be diminished or eliminated. There are lines and wrinkles in the skin. And that's what we are looking for. We are not looking for the poker face, right? We are not looking for the facial paralysis. We are looking for wrinkle-free face and the ability to express our emotions freely. Why now it is the best time to introduce peptide-based wrinkles correction, Myo-Fix? When we introduced this on the market in 2009, people been still very much passionate about the botulinum toxin. Now, more and more of people are finding some potential concerns about botulinum toxin injections. There are a lot of research about it, there are a lot of media conversation about it, and there are a lot of people who experienced some side effects themselves, and now they are looking for some alternative solution. It can be some unpleasant side effects like ptosis in the past. It can be muscles atrophy because for these patients who are using botulinum toxin injections regularly, more than twice a year, for 3, 5, 10 years in a row, part of the facial muscles become atrophic because they are non-functional, they are not used. Also, it can be secondary non-responsiveness responsiveness to the botulinum toxin, and patients are starting to turn their back on injectables. And now the study shows that in 24th, it is the first year when we observe the decline of popularity of injections amongst women in the United States of America, in the European Union countries, and in the United Kingdom simultaneously. It may be due to more studies and more press media conversation about side effects. At least that's how BBC thinks. And there are a lot of publications about it in Vogue, in Globe and Mail, and in other big outlets like Harper's Bazaar, Marie Claire, and other press. Also, skincare now is much more advanced. So it really can provide us with the nearest approach to botulinum toxin results. So people maybe no longer need, at least they don't need as many injectable treatment as they needed previously. There are more reports of this so-called no-tox trend or needle-free wrinkle correction, and now the new trendy anti-wrinkle solution based on different ingredients, peptides included. But remember, we've been first on the market in 2009. So we can target fine lines, we can target expression wrinkles without damaging our emotional life, without damaging our natural face expression, without using injections, without using invasive treatment. And Myo-Fix offers you this solution, and especially good, and it can be used in any period of life of women. So what is new in our Myo-Fix in 2024? Now we are using 5 peptides and probiotic. So what we have here, neuromodulating peptide arginine in 10% concentration, neuromodulating peptide lufizil in 5% concentration, neuromodulating innovative, absolutely new peptide monapsis, 5% as well, another new peptide idealift, which is neuromodulating and remodeling at the same time, also 5%, and 5% of world-famous remodeling peptide, Matrixil 3000. And to finalize the formulation and to preserve its beauty and add additional benefits to our skin, we are using probiotics derived from kimchi cabbage called lucidol. So how it works? Arginine, probably you remember the mechanism of action of the arginine. It was the very first neuromodulating peptide on the market. We started to use it in 2009. Arginine was developed through the methodology awarded by the Nobel Prize. It was developed by the Dr. Bruce Merrifield laboratory. And now we are using modified version of arginine, which is more powerful, penetrates deeper in the skin, and it is even more bioavailable by facial muscles. So arginine really mimics the botulinum toxin effect by targeting the exactly same complex which botulinum toxin targets. We are targeting so-called SNARE protein complex. It is a B complex, and the part of this complex is so-called SNAP protein. Botulinum toxin completely destroys this SNAP protein, but arginine acetylhexapeptide 8 doesn't destroy it. It replaces it because it's able to bind SNAP receptors in nervous cells, in motor neurons. So it destabilizes complex and decreases the release of neuromediator acetylcholine, which is essential for muscles contraction. No acetylcholine, no muscles contraction at all. Botulinum toxin destroys the SNAR complex, completely destroys the acetylcholine release. That's why muscles are completely paralyzed. If you eat something poisoned with a botulinum toxin, it will paralyze your body muscles, your diaphragm, and stop your ability to breathe. If we're using small dosage in the facial muscles, exactly the same, it's paralyzing the facial muscles. When we are using peptides, it destabilizes this complex and not blocks completely, but reduces the release of acetylcholine up to 25-30%, comparing with 67% of botulinum toxin. But we can do more. And that's why we are using another peptide called lufizil. It is neuromodulating. It is enkephalin-like peptide. Enkephalins, they are molecules of happiness, sometimes called happiness hormones. So it inhibits the activity of motor neurons. They became lazy, less active, and it's reducing the sensitivity of neurons to our brain emotional impulses. And most importantly, it's reducing the response to negative stimuli, improving response to positive stimuli. So when you feel happy, you express more freely than when you feel less happy. And it is actually really good for your emotional health as well, because you experiencing more positive emotions than negative emotion. And most importantly, it has amazing synergy with adrenaline. It's not only about happy face effect, but as you can see here on the picture, the combination of adrenaline with lufuzil can block the acetylcholine release almost up to 40%, comparing with botulinum toxin, which blocks the release of acetylcholine to 68, 69%. Yes, it's still not exactly the same, but it's more than half of botulinum toxin effect. And sometimes it's just enough. But we didn't stop here. In our previous version, we've got this combination of adrenaline and lufuzil, and it was absolutely best-selling, many times called the best approach to botulinum toxin injections on the market. It became huge bestseller during COVID and lockdowns time, and was called by Vogue UK and other media as the Botox in the bottle. But now we made it even more powerful. We added an innovative peptide monopsis that probably you don't see it on the market yet because it is very new, and it is a very first peptide capable of acting on both pre-synaptic and post-synaptic level. So it blocks the activity of motor neurons, but in the same time, it blocks the responsiveness of facial muscles to this emotional impulse. So it's really like kind of double effect peptide. And it addresses another part of this SNAR protein complex. If adrenaline is addressing SNAP protein, this one addressing new protein found in this SNAR complex called MUNC18. Why it is monopsis? Because it's addressing specific peptide with this MUN letters in the name. And this protein, MUNC18, it binds to the mobility molecule called syntaxin and actomyosin in facial muscles. So it really competes with this protein for the position, exactly like adrenaline competes with SNAP peptide, replaces it, and modulates muscles activity, adding this another half of Botox effect to the combination of adrenaline and lufuzil. So now we are really near to the botulinum toxin effect without using any toxin. So it's like toxin-free, but highly efficient wrinkles correction. And the new peptide Idealift completes this neuromodulating part of the formulation. And actually, it is skin identical peptide because we produce it in our body. It's naturally circulating in our body through releasing of same enkephalin molecules, hormones of happiness. So it acts in our body like an opioid neuromediator. And additionally, it's not only neuromodulating, it's not only improves and increases these happy face results, but also it is remodeling peptides, helping to improve on different stages elastin formation. And it relaxes mimic muscles, but in the same time restores the skin deep tightness via the skin architecture. So it is 2-in-1 peptide. And we need not only elastin, right, in our skin, we need collagen as well. And that's why we are using the most active collagen booster known to the cosmetic science, called Matrixil 3000. It is highly remodeling. It activates the synthesis of 4 types of collagen in the same time. Collagen first type, collagen fourth type, both known as youth collagen in the skin, but also 7th and 17th types of collagen, helping to restore the skin structure and activate the regeneration process in the skin. Simply speaking, it feels wrinkle from inside. It plumps the skin. Also, it's activated synthesis of another essential substances like hyaluronic acid, fibronectin, and even growth factor, TGF factor, which is activating fibroblast activity. It's really anti-senescence treatment. So Matrix L3000, it's the best you can use for active longevity of your wrinkled skin to plump skin and to fill wrinkles. And it inhibits glycation, so fights this infamous sugar phase, reducing wrinkles and improving skin elasticity and tone. And finally, the last but not least, probiotic. Because we are using probiotics everywhere right now, right? We need this help, we need this support to our skin microbiome, because the skin microbiome, it's inseparable part of the skin. Happy skin microbiome equal to healthy and beautiful skin. So we are using this lucidal probiotics. It's a culture derived from the biofermented kimchi, and it restores the health of the skin microbiome, and in the same time moisturizes skin, brightens skin color, and reduces all signs of inflammation and sensitivity. So it creates this formulation which is much more than wrinkles oriented. So once again, how it works, to explain it better to your patients and clients, we have 4 neuromodulating peptides, destabilizing proteins involved in the facial muscles contraction. So your facial muscles entwined into your skin in forehead area, glabella area, crow's feet area, upper lips, they are gradually relaxing. It takes 5 weeks. If wrinkles have been very deep, probably it can take until 10 weeks time. But in 5 weeks, you will see the great improvement. We use remodeling peptide to plump skin and to filling lines and wrinkles, and we are using probiotics to restore water holding capacities of the skin and the skin barrier. So we recommend to use Myo-Fix Active Care Cream for 5-10 weeks on the daily basis. If you could offer weekly Myo-Fix treatment to these patients, it would be absolutely amazing, and it would maximize results of the treatment significantly. But for some people who cannot come to your clinic or to your beauty salon on the weekly basis, you can offer monthly treatment and recommend to use Myo-Fix Active Care Cream between 2 treatments. Results of 5-10 weeks course will last up to 6 months and sometimes even longer. And you could use it to prolong results of injectable wrinkles correction. Using in between injections, we recommend to offer first Myo-Fix treatment or start to use Myo-Fix Active Care Cream on the 16-18 weeks after Botox injections or Xeomin injections, and on 21st week after Dysport injections, because Dysport is more long-lasting. And you can use it to create this space between injections, which is helping people to restore the natural emotional mimics in their face and to experience the full spectrum of emotions once again, to restore the emotional intelligence, to restore the normal level of empathy and even sexual pleasure, as science told us. So, what are advantages and innovation in our new formulation of Myo-Fix in 2024? It's the highest concentration of peptides on the market, about 30%. There are 5 peptides. As far as I know, no other brands using this combination of peptides and using 5 peptides altogether. And it contains a probiotic. So it's a microbiome-oriented probiotic-based solution in the same time, which is highly trendy now. So a lot of people, they are attracted by probiotic-based skincare. And The price is almost the same. We are offering it in the United Kingdom for 89 pounds, and I believe it is 115 American dollars. So it is not, it doesn't cost you, the fortune. And one bottle, 15 milliliters of Myo-Fix Active Care Cream, it's largely enough for 5 weeks of daily use. So Myo-Fix 2024, it's more than wrinkles. It's relaxing expression muscles, boosts the synthesis of 4 types of collagen, boosts synthesis of elastin, boosts synthesis of hyaluronic acid, fights glycation, restores a healthy skin microbiome, and moisturizes and brightens skin. If it is possible to make something better, I don't know how. I think for now, it is the very best skincare solution addressing expression wrinkles on the market today. So I hope you will love it. I hope your patients, your clients will like to use it. And now that's an amazing time to offer this new Myo-Fix in your clinic, because that's the best season of the year, right? November and December, everyone wants to look better at this time of the year. So I wish you luck. If you have any questions, please write your question in the chat and I will be happy to answer them. Thank you very much, Oana. Can Myo-Fix can be used with retinoic acid? Probably. Thank you for this question, and so sorry I forgot to mention it. Like in the last 15 years, I didn't find solution to keep peptides protected from active form of retinols or hydroxy acids. Unfortunately, glycolic acid, salicylic acid, kojic acid, azelaic acid, and retinoic acid, as well as retinol and retinyl aldehyde, can damage peptide structure because peptides are small, fragile molecules. So I don't recommend to use retinol or tretinoin-based solution in the same time as our Myo-Fix. I always recommend to take a break from retinol in the time of Myo-Fix treatment, but as you know, even better than me, then some of our patients are a little bit stubborn and they love the retinol products. They never let them go. At least let's ask them, do not apply them on the skin in the same time. Okay, so they can use the retinol-based solution once a day, and they can use Myo-Fix once a day. Results will take longer, but at least Myo-Fix will not be damaged. But thank you so much for the question. Really forgot about it. Unforgettable. Thank you so much. If you have other questions, please just send them to your managers. They will be happy to help. If they don't know the answers, they will ask me. And we will send you video of webinar tomorrow. And if you have any question, please feel free to come back to us. And obviously, you can order our new formula since today, after the webinar. Thank you so much.